Many of the conversations in Nairobi, the epicenter of COVID-19 in Kenya, are about the disease. The government has restricted international travel and closed schools and universities. Kenyans advised to wash hands regularly, stay home if possible, and avoid large gatherings. But doing that in makeshift slum housing is nearly impossible. Areas where millions of people call home, many sharing single-room shacks, have few spaces to isolate or enjoy the luxury of working from the house. Most live on less than $2 a day. This is one of the most densely populated areas in the city. People here are not just worried about the disease and how it may affect them, but also how they will survive with no money to feed their families or even enough water to regularly wash their hands. HADIJA washes clothes for a living. She shares 2 rooms with more than 10 orphans in the sprawling MATHARE slum. Her biggest concern right now is finding water. In normal circumstances, she uses 80 liters a day, costing around $4. Some non-profit organizations are setting up water points, but they're not enough.
We get government water only thrice a week, which we have to go and fetch at water points. They tell us to wash our hands all the time. We want to, but without constant water supply, what can we do?
MUTISYA, who lives in MATHARE, recorded the hustle and bustle in the slum for Al Jazeera following the introduction of the government's health restrictions. He tells us disease is rife, including the common flu, which poses a problem.
Even now, many people have the flu. Children are always coughing. It's a common thing and difficult to tell if it's corona or not. There is nowhere here where we can get tested. It's very hard for the residents to go to big hospitals in town. Instead, they self-medicate.
The government is testing people with symptoms and their contacts, as well as starting random tests in targeted areas. But medical experts are urging preparations for mass testing should the disease start spreading quickly.
We need to have a lot of people trained on testing. That is number 1. Number 2, we also need to expand our testing facilities beyond where we are now.
Doctors say they hope to minimize the spread of COVID-19 to areas such as MATHARE, where some of the most vulnerable Kenyans live. But HADIJA and others here want more preventative measures now to keep them safe. Catherine Soy, Al Jazeera, Nairobi, Kenya.